Action.
Hi guys, it's Tassar Paris. I'm here with the best plastic surgeon in Beverly Hills, Dr. Obeng. I just had a few questions for him. Some of the questions that were asked by some of the ladies that I know that are interested in plastic surgery. So we're here today. How are you feeling?
Thank you very much for visiting us, Tassar. I feel great. I'm blessed and highly favored.
Okay.
Thank you for visiting us.
Thank you
What's
so
your
much.
first question?
Okay, so my first question is, what interested you to become a plastic surgeon?
Good question. I grew up in Ghana and I saw a lot of diseases and illnesses that were attributed to supernatural forces. And witnessing the good works of Operation Smile compelled me to seek a career as a plastic surgeon. So that's why this journey began. Thank you, Operation Smile. And thank you, all my teachers and the people the village who raised me. Thank you.
God, that's a beautiful answer. Okay, next question. How important is it for post-op care after cosmetic procedures? And if not followed, what are the results?
The question is, how important post-op care? Okay, how important is post-op care? Post-op care is everything. Okay, surgery is only 30%. But post-op care is the most important thing. And if you are not willing to spend money on post-op care, don't waste your time. Writing a big check or putting a big surgery on your credit card. Okay, we can only do so much. We are not God. But the aftermath, the way you take care of yourself, the way you follow instructions, okay, and the way you eat and carry yourself determines how well your results is going to be. Okay, a surgeon can do a beautiful job in the operating room, but if the patient is not willing to embark on a post-op journey that encompasses taking a very good care of themselves, they're not going to be good. Okay, liposuction, you got to have garments. Some people go to the extent of getting hyperbaric, which helps. So get your garments, okay, get your massages, okay, and please keep in constant communication with your plastic surgeon. Scars, a lot of people are worried about scars. Scars, it takes the average scar 18 months to mature. They don't get better overnight. The only creatures that do not scar are salamanders. They regenerate. So people are so concerned about scarring, but you can modulate your scar by massaging your scar aggressively, okay, and wearing silicone gel sheets. And over time, and also preventing it from sun exposure, because the sun is your worst enemy. And over time, it gets better. If you follow all these little important tenets, everything gets better. So post-op care is everything. Okay, so don't waste your money having surgery if you're not willing to invest in post-op care, which doesn't cost as much as the surgery. Okay, aftercare facilities are very important. I don't put all my patients in aftercare, but if you can afford it, it's good for the first night. Okay, make sure you get your garments, make sure you get your lymphatic massages, make sure you get a good supportive bra. Not every plastic surgeon sells all these things in their office. However, you can purchase these online. Okay, and make sure you follow up with your doctor or his staff or her staff.
Perfect. What is your favorite procedure to perform on a patient?
My favorite procedure to you got me going. My favorite procedure to perform, okay, it's a surgery or procedure that I feel like I can make an impact. Okay? And it's really not cosmetic surgery. I just love to do cosmetic surgery because I'm the best at it. But my passion is doing free surgery. And I like to do surgery that nobody can do. And that's my favorite procedure. The most challenging cases is what I like to do. Okay, when I was younger, I would have said my next procedure, but not even. Next.
Okay, guys. So with a BBL surgery, how long should a patient wait before they can sit?
Most people tell you 3 weeks. Okay? As a doctor, if you give a patient an inch, they always end up taking 6 inches. Theoretically, after 6 weeks, theoretically after a week and a half, you should be able to sit. But we tell patients 3 weeks, okay? Of course, you have to sit, you have to use the bathroom, you have to do all these things. Try not to sit too long And after every 5 minutes, you lift up. Okay, so that the cells can breathe and they can be oxygenated. So the rule of thumb is 3 weeks. 2 weeks, okay, no for the first week unless you actually have to sit. Second week, no. Third week, you can just start doing the sitting protocol.
Perfect. Okay. If a patient doesn't have enough weight, what are the other procedures for a BBL?
Great question. Okay, ladies, gentlemen, whoever you are, if you are listening to this, I hate when plastic surgeons tell patients to go gain weight. We all know how difficult it is to lose weight, okay? So I don't tell my patients to gain weight. If you don't have the necessary fat to harvest and to use it to reshape your butt or to do a BBL, your next best option, in my hands, are butt implants. Okay? Butt implants, they work, they are quick. If you get older, if you don't like it, you can take them out. I'm not a big fan of the so-called shots that a lot of people are doing in the hotel. Okay? There are some other fillers out there that have been tried. It works, but to me, it's very cost prohibitive. It costs a lot of money in the great hands, in good hands. So the next best option, if you don't have fat, is implants.
And I think that question, yes, because there's so many women who are interested, but they just can't find the right doctor that can do the implants and make them look natural.
That is true. Not every doctor can do implants. Some doctors don't like to do them. The complication rate is much higher. There's a 25% complication rate. Okay? 1 out of 4 people will have issues, will have problems, but that's the name of the game. Okay? And if you are going to invest in it, I tell my patient, go get hyperbaric oxygen. Make sure that you are very disciplined because you can't sit. Because you can't sit, you can't walk upstairs. Because every time you move, there are shearing forces that can disrupt the sutures. But if you find in the hands of a good surgeon and good pocket placement, you should have very good results. But you have to find a surgeon who is willing and who has done it and has a track record of doing these type of surgeries. Okay?
This is where you guys need to come. And then the last question, which is the most anticipated question, how did you figure out the formula to remove the most talked about viral Gorilla Glue procedure?
I prayed to God and God gave me an answer. By God, by the grace of God. Life, education, we all are given fundamentals, okay? And as somebody who always goes back to fundamentals, when you see a problem, okay, you can break the problem down into little pieces and solve it. That's how I live my life. I solve problems by breaking it down. And that's how I do for testicles. Okay, first, of course, if there's an ingredient, what do? You have to look up the ingredient. What's next? Well, I can bring that ingredient, okay? Then you have to look, is this toxic to the body? If it is, how do I make it less toxic or harmless? And these are all the steps that we do. And that's how we came up with the perfect formula to dissolve the Gorilla Glue. Thank you very much for your time.
Thank you. Thank you so much.
Okay? And hopefully next time we'll meet again.
Thank you.
Booyah, 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 booyah. It's a rap, ladies and gentlemen. We just heard the lady herself. Your name again?
Tassar Paris.
From?
I'm from Arizona.
And what brought you here?
I'm here to shadow, and I'm here just to learn about surgical, as a surgical tech. That's what I'll be going to school for, so. Came to the best place ever.
And how does it feel being here with the man, the myth, the legend?
Honestly, I was kind of nervous, but I feel like I learned so much with his team, with the surgical tech that's here. He taught me so much, so learned a lot. I'm very thankful, so thank you.
What's your advice to others who want to get plastic surgery?
Go to the best doctor, which we're speaking to the best doctor. So, I mean, you really have to do your research and figure out who can make you look the way you want to look.
That's
Very important.
what's up. Booyaka.